Selamat pagi, Bapak dan Ibu. Selamat pagi untuk yang sudah hadir di acara Forum Kajian Pembangunan pagi ini. Good morning for everyone who has joined us this morning on Forum Kajian Pembangunan. Today we are very lucky to be co-hosting the webinar with the Indonesian Regional Science Association. As I mentioned, as we have shown earlier, there are some technical information about the webinar. I will just raise a couple of items, which is that we are being recorded. So if you are participating in the seminar, you are agreeing to be recorded for later uploading to YouTube and for other purposes. We also would like to point out that you are all muted at this point. All participants are muted. And during the question and answer session, you have the option of posing your question using the Q&A box at the bottom. You can find it, the Q&A box, not the chat box, but the Q&A box. And you have the option also to pose your answer, to pose your question by using the raise hand feature. And we will unmute you, but please note that to make your question brief, to give an opportunity for other attendees to also ask their questions. So we will start this morning with a opening remarks by Professor Arief Anshori Yusuf from the Indonesian Regional Science Association. So Pak Arief, the floor is yours.
Thank you, Lydia. It is a pleasure for me and IRSA to be part of the FKP project. I think this is not the first one, and also NU has been IRSA best friend as a sahabat IRSA for so long. It's always been participating in all IRSA event. I think all along. Well, my opening, I think I will just want to share with you that this event is actually an initiative from IRSA because last year we didn't really have routine conference and we routinely organized because of the pandemic. It's supposed to be in Jakarta, but I think it's not prevent us. It didn't prevent us from also having book publication from that year, and it's quite timely and topical because we feel that there is no yet the regional perspective of the COVID crisis in Indonesia. I think this is our obligation, partly to contribute to the solutions and lessons about what's going on in COVID-19 and how can we fix, how can we see the angle from regional perspective. And actually the seminar today is a presentation or featuring some selected chapter from the book. And the book itself will be our IRSA series, it's a book series on regional development number 19, which we title as Regional Perspective of COVID-19 in Indonesia. And it will be edited by Pak Budi Resudarmo, Pak Sony Piarsono, Mas Devanto, Mbak Tri, dan juga saya sendiri. This book will have at least 3 sections. It will be one about interregional perspective. We have selected 5 chapters from this. I'm not going to read the whole title, but I just want to give you a glimpse of what will be in the book. And also we look into Western and Central Indonesian angle perspective, and then the Eastern Indonesian perspective. So it's quite complete actually. Of course, I think I will end my remark by thanking FKP for giving us the opportunity to share this. This is like a mini IRSA conference like due last year. So So thank you for FKP. And also thank you for Pak Budi for initiating this and everyone who edited this book, and also for those who already work hard to improve the book along the process. For me, IRSA initiative has always been a nice escape, yeah, from so many things that going on in Indonesian academia. Because first thing first, if I invited people to be part of the book chapter, they will say it's not in the remunerations. It has to be journals. So something going on not quite right, yeah. But when I back to IRSA, yeah. So it seemed that I depart from some environment that I don't really big fans of it to some community that actually a lot better. Yeah? People appreciate the true contributions disregarding of what the system is. And I think this is not large. I mean, we already have the critical mass for that. I know it's not nationwide yet, but trust me, IRSA is a good community where academic with true intentions of giving contribution to science, to society, have a very, very comfortable place. I'm one of the, like experiencing myself. So that's, I think, my remark. Please enjoy this FKP seminar series and have a good discussions. Thank you, Lydia. I think that's from me.
Thank you, Pak Arief. Thank you so much for reminding us of this great community, which actually I will remind everyone started in 1997, if I'm not mistaken. So more than 20 years later, it's still going strong. So that's a huge congratulations to IRSA. So Dr. Tri Mulyaningsih of Universitas 11 Maret will be chairing the session, which will feature three speakers this morning. So I will give the floor to Ibu Tri to chair the session. Silakan, Ibu.
Terima kasih, Mbak Lydia. Can you hear my voice clearly? Okay. So thank you, everyone. Good morning. Selamat pagi, Sugeng Enjang. So today we are very delighted to host the IRSA seminars, and this is the first sessions of the IRSA seminars because we have two sessions. So today's session we will have 3 papers, and next week on the 11th of February we will also have 3 presenters for IRSA seminars. So the topic for today's seminars is regional perspective of COVID-19 in Indonesia. And we are very delightful to have 3 presenters. I will read the titles and also their short CV to begin these sessions. So our first presenters is Pak Rimawan and Putu Wigita, Pak Rimawan Pradiptyo and Putu Wigita from Universitas Gadjah Mada. And they're going to present their papers titled Maintaining Community Resilience During the COVID-19 Pandemic Through Online-Based Social Capital, the Case of SONJO or Sambatan Jogja. Selamat pagi, Pak Rimawan.
Selamat pagi.
Yeah. So Pak Rimawan, currently he is the head of Department of Economics, Universitas Gadjah Mada, and he received his PhD from the University of York. And Putu Arya Wigita recently graduated from Universitas Gadjah Mada, and currently he is working full-time at UGM. And our second presenters is from West Kalimantan, Ibu Nurul Bariyah. Selamat pagi, Ibu Nurul.
Selamat pagi, Ibu Tri. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Ibu Nurul and Ibu Yarlina Yacoub will present their papers titled Border Province Dynamics During COVID-19 Pandemic, a Study of West Kalimantan. Ibu Nurul is currently the head of Department Economics and Development Study at Universitas Tanjungpura in Pontianak, and she received her PhD from University Malaysia, Sarawak. Dr. Yarlina Yacoub, also a senior lecturer at the same university. And I would like also to introduce our third presenters, Bapak Agus Suntoro. Halo Pak Agus. Okay, selamat pagi Pak Agus. Thank you for. Okay, thank you. And Pak Agus and Zsabrina M. Ayunda from National Commissions of Human Rights or Komnas HAM. They going to present their paper titled Constitutional Rights in the Regional Elections During the COVID-19 Pandemic. So Pak Agus has worked for Komnas HAM since 2008 and as well as Zsabrina, working for Komnas HAM. So that's my introduction for the three presenters. So we're going to start the presentation by welcoming Pak Rimawan and team to present their papers. 15 to 20 minutes, Pak Rimawan. So probably 2-3 minutes before the time end, I will give a gently reminder. So floor is yours, Pak Rimawan.
Okay. Thank you. And good morning, everybody. It is delighted for me and also Mas Arya to be able to present in this event and share our experience with SONJO, experience with you, basically. So, sorry, it's a bit difficult for me to navigate this. Yeah, okay. I want to put it. There you go. Okay. So this is the way we just want to start with the way the game theorists thought about COVID. So basically, the pandemic COVID is some sort of switching of the nature. The nature change from something that we already know to something that's totally we don't know as yet. So if we talk about, in the old days, there's mobility and crowd is a basis of economy, but now those two things will be very dangerous for us because that will it's creating, the spread of the virus basically. Then the idea is that, of course, if we talk about the condition in Indonesia, we don't have a capital, to be honest. We're not like Singapore or Malaysia, particularly like Singapore. They can say, okay, you can stay at home and then we will subsidize you, basically. This is not the way it works in Indonesia. Then what we need to do here, there's a difference in ability of the government to support the household and the businesses, and it is requirement as well for us in order to prevent the spread of the virus, is to stay at home, and this will be very difficult for us, obviously. So what we're trying to do is that if we do not have capital, is there any possibility to promote the social capital to replace that, or to compensate at least? So this is some of the literature regarding the social capital, and this is the way we see the problem. The COVID, is it disaster or war? We thought that it should be thinking as a war rather than a disaster. Disaster is much easier it's happened once and that's it usually, and then you trying to revive the situation. But this one, the COVID, is different because it's prolonged, and there is a possibility of second wave and third wave, and the similar case that we learned from the Spanish flu. Now, so it may take 2 or 3 years, but then the problem is that COVID is our common enemy, and because there is non-rival and non-excludable properties of that. So the way how it works is if we perceive this as some kind of a war, and this one is a total world war, real world war, actually. It's much, the escalation is much bigger than the Second World War. In Second World War, it's just only consists of 3 continents that's involved in the Second World War. But this time, every country has to fight the COVID. So the way the dominant strategy that we promote is expect the unexpected in terms of the impact, thinking the unthinkable in terms of the alternative solution, and the most important thing is how to mobilize the resources. Now, this is the problem that we at the moment that we have. The government try to always thinking about how to end the game, but it's actually the game is not from it cannot be controlled by us. It's controlled by the COVID itself, basically. So this is the problem that we have. Yeah, we want to finish as soon as possible, and we can see it from the government perspective how they rely on the vaccine, for instance, but they forgot about the treaty. Yeah. Now, so I'm just wondering about just working on how to mobilize the resources. And if we see the government, of course, that doesn't have sufficient resources. If we talk about the GDP, our GDP is 16,000 trillion, but the government budget is probably around 2,500 trillion. But so basically they don't have enough sufficient money. So how we can do is how to mobilize the resources among the household and also the businesses. That's why we use what I call Sambatan. Sambatan is the old gotong royong. Yeah. So in Java in particular, up until 1980s, there was a gotong royong. It's called Sambatan. If you want to develop your house, then you need to ask your neighbor to work for you for 2 to 3 days and compensate them with a cigarette, coffee, snack, and also lunch. And after 2 days, voila, your house is developed. So this is the situation. So we developed what I call the SONJO. SONJO is humanitarian movement, and this has been developed since 24th of March. So this month will be the 10th month of the SONJO, and we use the WhatsApp group basically. At first, based on this paper is we only use the observation up until end of November, and by then we have 10 WhatsApp group. So the focus of the SONJO basically is on how to help the vulnerable and people at risk due to the pandemic COVID, and we use the values of SONJO as transparency, empathy, solidarity, and the synergy. Okay, so how to, now this one is usually many people asking, how can you develop the social capital, or like SONJO, Sambatan Jogja, in a short period of time, and then you manage to get so many people join. At the moment we have 1,500, but then when we wrote this paper it's about 1,000. So it's based on one thing, it's trust. So no money involved in SONJO. So up until now, the cost of SONJO basically zero. Yeah. So we just use our spare time and use our energy and how to coordinate among others, and that's how we solve the problem, basically. So and the trust is based on what? But based on two things. First is integrity, and the second one is the transparency. Okay. So this is what we do, and this is not surprising actually. This kind of measures, because most of the earlier the main founder of SONJO, we actually is come from the academia, from UGM, who works mostly on the transparency and anti-corruption. Okay. So now this is probably that's make it slightly different to the way the government works. The government always thinking about the budget absorption. I'm sorry, budget absorption doesn't work in these circumstances, in these critical circumstances. If the government is still thinking about the KPI, which is a budget absorption, forget it. It doesn't work. We don't work in that way. We work on the outcome. The most important thing is how to achieve outcome. Yeah, not thinking about the budget absorption. Okay, and this is the way we work. So basically we start from something simple, and then we follow the process, and then it's become more and more complex movement. And also we're trying to upscale the program. Up until now, we have about 15 programs. But back then, in November, when we wrote this paper, is about 10 programs that we have. But then we have 3 sectorials that we work on. First is the economy, the second one is health, and the last one is the education. And what we're trying to show in here is the economic impact. Now, there is a problem in measuring the economic impact, basically, because it is not easy to find the hard evidence in terms of the transaction and that kind of stuff, because most of the things, like the apps and everything that what we trying to develop is basically free, is costless. But then we help people. But then the problem is, the downside is that we cannot identify the outcome in some of the program. So it starts from one WhatsApp group, it's become 10 WhatsApp group, and then we use the website, database, apps, and also the social media. We also have the compliance committee. So what is the compliance committee? Compliance committee is basically, we choose from 5 members in there that to ensure that everything what we do in SONJO is compliant to the government regulation. Now, this is the one that we use. So if we start like initially it's only one WhatsApp group, it's become 10, yeah. And then we also use the database. We have a Google Sheet, and also we develop the demand and supply of the food. And nowadays we also have a demand for supply for the PPE, personal protective equipment, and also the bed, because we support what they call the shelter tangguh, yeah, in Bantul, and the requirement is that they need 416 beds, for instance. Okay, and the way we use it, we always use the double auction. So how we solve the problem is usually using WhatsApp group. If any, we can do data Excel. It's very simple. And the principle for dealing with demand and supply, how to match between demand and supply, is using the double auction method. And this one is ranging from many programs from in a SONJO itself. And then we start to have a website. Yeah, and then we use the apps and also the social media. So this is now, I just want to show you that there are 4 programs that are related to the economy. And I'm sorry that most of the terminology in SONJO is Javanese. And why? Because we are we are operating in Jogja, and we always give a cultural touch. So make people link between the movement and also themselves. This is the earliest program that we do. This is what I call the database SONJO Pangan. So what we try to put is we use the Google Sheet and then send it to everybody, to members of SONJO, and usually they will tell their friends. And up until 28th of May, we have 200 and it's about 1,000 of SME and also even supermarket. Yeah, join that. And this one is interesting. So if you want to buy something, you just click that. You just want to buy something, and then you can list, and then you can call them and buy using Gojek or Grab and etc. And then we have in Ramadan, we have a SONJO Ngabuburit. So how the Ngabuburit works? Again, this is a double auction things. So we said to we said to our colleague from culinary, and then he said, okay, please feel free to advertise your product between 3 o'clock until Maghrib, until 18 o'clock, yeah, 1800. So, and then people starting to give a simple message in a way, in WhatsApp, but then it's become more elaborate. Some people creating poster, yeah. And then we blast it to 7 WhatsApp group, and that's increased the sales. And then we can see this one. So this is some of the confession from a testimony from our partner. So the lady in the right-hand side, actually, previously the revenue is always, about 1,000 kg per week. Yeah, that's her business. But then during the pandemic, it's become 0 or 20 kg per week. And she has 5 employees at that time. And then she joined SONJO, and then it's creeping, becomes 60 kilogram, increased to 250 until 350. And then prior to Ramadan, she sent me WhatsApp and thanking for, because she managed to pay the THR, yeah, to her employee. Yeah. So this is what we can gather, in terms of the outcome, is come from this kind of testimonial things. And also after the Ramadan, we, of course, the working out Pupurit doesn't apply any longer. And then we create the Maskilan, Kumilang Arya Sahadewo. And then he said, why don't we use the Glides app? So Glides app is basically for address book, but this fancy address book. And then we change it to be the this one, EPS, Etalase Pasar Sonjo. So this is like a showroom. Yeah, you can order now if you wish. Yeah, because some of the product is actually can be delivered in a frozen, vacuum frozen or can. Yeah. Now its cost is 0, of course, in there. And this one, until 30th of November, there was 320 traders registered within the EPS. Okay, and why is it that we use the EPS? And why don't people say, many people suggest me, why don't you use a marketplace and then you can send it to, you can sell it to the US and etc. No, the problem is that most of our traders who join with us, they only use WhatsApp for the communication, nothing else. They don't even use the GPS. They don't use the Google Map at that time. So when we create the Etalase Pasar Sonjo, so this is like a stepping stone for them to reach the marketplace. So we have 2 outcomes in here. If they can increase the revenue, that's good, that's outcome. Another outcome is that when they join the Etalase Pasar Sonjo, and then afterward, they manage to join the marketplace. Because this one is basically huge leap to be able to join to the marketplace. This is not easy, because most of our colleagues, that's in the age of 40, 50, or 60. And most of the time, what they have is a physical transaction. So what the SONJO have done in terms of the economy is transferring the physical transaction to electronic transaction or online transaction. Okay. Then we have also trying to open the possibility that each member can share their knowledge. Now this one, he's Pak Hanum with Miletak. And he showed to us how to use the vacuum frozen packing. Yeah, and then we accommodate this into the program. It's called SONJO Mikunani. Mikunani is basically his benefits. Yeah, and now many of our partner using the vacuum frozen. So they can produce in Jogja, yes, but their market is not in Jogja any longer. It can be in Jakarta, can be in Kalimantan and Sumatra and etc. And this is flourishing. So if you talk about many UMKM died or collapsed, unfortunately not in SONJO, because in October they start talking about the innovation. They start talking about the innovation. Yeah. In April they're struggling about how to sell things. In October they start talking about what kind of innovation that we can do more. This is the situation. It's very interesting to see the development of this. And we also have this, the fashion show, online fashion show using the PPE at this time. And this is the one that we do, and we invite ministers and everything. Now this is, we also have the program is called SONJO Observer. So this observer is for anybody who do not live in Jogja. They're welcome to become part of SONJO, and we can give you the time for 7 days. And then afterward, you can please feel free to imitate in your, or you can replicate SONJO elsewhere. And apart from that, we also accommodate them, the alumni of SONJO Observer in the WhatsApp. It's called the SONJO Pembelajaran. Okay. Okay, so this is the situation basically. So there is a possibility that we can help each other, and this is very wonderful to do things. So we also have many collaboration with other groups like SONJO. For instance, we have a collaboration with SONJO. SONJO is in Magelang, and every Sunday evening we have the webinar is called SONJO Angkringan. So SONJO Angkringan talking about all kind of things that related to COVID. That's something that we face, and now the SONJO Angkringan become the trendsetter, because many media start to quote from SONJO Angkringan. So they join SONJO Angkringan, and then all of a sudden tomorrow morning there is a news in Harian Jogja or sometimes Cetek talking about the materials that we discuss in SONJO Angkringan. So I think this is from my sharing regarding the SONJO and how to develop the social capital, which is is quite challenging. The most challenging thing is actually how to follow the dynamic of the development of the situation at the moment. I think this is from me to Putri. Thank you very much.
Thank you very much, Pak Rimawan, for timely presentations, and it's very insightful. So we will move on to our second presenters, Ibu Nurul Bariyah. Okay, Ibu Nurul Bariyah, time is yours.
Okay, thank you, Putri. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. A very good morning to Chairperson, editors, presenters, and all participants. My appreciation goes to FKP, IRSA, and Indonesia Project for hosting this seminar. Thank you, Mbak Lydia, Prof. Arief, Prof. Budi. Our chapter entitled Border Province Dynamics During COVID-19 Pandemic, a study of West Kalimantan, written by me and my colleague, Ibu Yarlina. So West Kalimantan is one out of 4 provinces in Indonesia that share borderland with other country. This is organization of our chapter. So in the end of 2019, COVID-19 in West Kalimantan was just news about what happened far away in Wuhan that nobody thought will affect us at all. Sudden awareness of COVID-19 in West Kalimantan was started upon confirmation of first cases in Malaysia on 25th of January 2020. So due to West Kalimantan proximity to neighboring Malaysia and Brunei Darussalam, upon confirmation of COVID-19 cases in Malaysia, the governor of West Kalimantan himself appealed for the public in said province to remain vigilant and to refrain from traveling to nations with known cases of infection. He also appealed for Ministry of Transportation to close direct flight from Pontianak to Kuching in East Malaysia and from Pontianak to Kuala Lumpur, West Malaysia. And then not long after that, come the announcement of first recorded COVID-19 case in Indonesia by President Jokowi on 2nd of March 2020. This created a noticeable shift in paradigm, including in West Kalimantan. There were boom in chatter on social media and many other platforms with facts intermixing with hoaxes. And there were also warning from local leaders in West Kalimantan regarding risk of infection. At that time, however, the West Kalimantan public was still optimistic about the overall situation, with markets, schools, campuses, offices, and other places functioning as normal. Several domestic and foreign flight activities or trips still continued. Yet, despite all efforts, first cases were detected in West Kalimantan. And based on information from Health Office, those first 2 patients had a history of traveling to Malaysia earlier. So in view of these rapid changes challenging people's life in West Kalimantan because of the COVID-19 pandemic, This chapter aims to elaborate socioeconomic condition, government and people respond, and what sort of mechanism and processes used to cope with the problems, bearing in mind that West Kalimantan is separated by a thin line of border from other country, which is Sarawak state of Malaysia. So I'm going to highlight COVID-19 cases in West Kalimantan. Out of all provinces in Kalimantan, West Kalimantan was the first one to confirm a COVID-19 case. However, the number of confirmed cases in it was the 8th lowest in Indonesia, or 0.5% of total cases in Indonesia, while the number of casualty was the 4th lowest in Indonesia, based on data from Satgas COVID-19. In addition, the Indonesian COVID-19 task force reported that in July, the recovery rate in West Kalimantan was the highest in Indonesia, with 97% recovery rate. Keeping in mind this impressive figure, though, is that the percentage of West Kalimantan's population to have undertaken the test so far is 13%. This number itself varies between regencies and cities, with about 45% of people that went through the test residing in Pontianak city. We also heard about a new statement from Ministry of Health regarding the number of persons taking the test versus the number of specimen. It could be the same person repeatedly taking the test. So the test coverage is still very low. So based on observation, it is plain to see the dynamicity in the spread of COVID-19 as West Kalimantan. At this point, COVID-19 virus has spread to 14 regencies and cities in West Kalimantan with differing severity, as can be seen from the graph. So the color representing the risk. All of regencies and cities in West Kalimantan fall into category either low or moderate risk. So as the 4th largest province in Indonesia, the regencies and cities in West Kalimantan can be divided into 4 categories: the cities, inland, coastal areas, and border regions. Data related to COVID-19 cases and regions categories are provided in the table. So various categories of these areas are at risk of COVID-19 transmission. Urban areas, for instance, with high mobility and dense population have a high transmission risk. The same can be said for areas bordering other countries where COVID-19 has already spread. The coastal areas, which are from entry points of COVID-19 via water transport, carry the same problem. Compared to these 3 areas, the inlands usually have less transmission risk. So according to BADRA 2020, high population density usually correlates to a high percentage of cases. However, the 3rd most dense region, which is Mempawah, have lower percentage cases than West Kalimantan. And then another thing is, the upper part here is the border region. And then this is the coastal area. And then if you can see my cursor, and this is the inland region where where West Kalimantan bordering with Central Kalimantan. And then according to Koopman 2020, areas bordering other countries where COVID-19 has already spread, in this case Malaysia, have a high transmission risk. However, only 1 out of 5 border regions has higher percentage cases than West Kalimantan, namely Sintang. While busiest border region, there are 5 border regions, and the busiest one is Sanggau. Sanggau itself fall into low risk category with low percentage cases. Actually, Sanggau is the only crossing open during the pandemic for repatriation, return migrant, and also for Indonesian who need medical treatment in Malaysia. And then list dense in the region categorized as a moderate risk, Melawi, while on the other hand, both cities have higher percentage cases than West Kalimantan. However, they categorized as a low-risk region. Nisira and Cowell argued that urban areas tend to have more effective preventive measures compared to rural or interior regions. And then one list dense coastal region has higher number of cases, but Ketapang is known with a big foreign direct investment from China. And then this is the local government response and challenges. So the detection of first COVID-19 in West Kalimantan from the government to order students to study from home, effective 16th of March 2020 until now, prohibited non-essential travel, order all civil servants to work from home, and then limit operational hours of business and reduce mobility by what's so-called jam malam at that time. So there was also the matter of China's custom of great prayer ritual. Is a big one, for which many relatives from other parts of Indonesia and even from other countries would have come and traveled to West Kalimantan. For that end, the government issued a regulation of temporary ban of burial prayer activities and religious rituals in the open. Wedding reception also not allowed and other events. Unfortunately, not everyone follows through with the regulation. The challenges in terms of education, the challenges of online learning come in form of limited internet access, especially for students living in remote areas. In Indonesia, only 34 students have a computer to use for their schoolwork, and only 40% of students have access to internet, according to OECD, let alone in West Kalimantan. Students in West Kalimantan, especially in Pontianak, use cafes, among others, to get internet connection for online studies, which might lead to the spread of the virus. Actually, we don't want them to go to campus to avoid being together with their friends. Instead, they go to another place. While many of them that do not have computer have to use handset or handphone instead. This limitation raised concern about the effectiveness of online learning. And then in terms of prohibition of religious activities in public area, especially during the holy month of Ramadan, the community is divided between worship at home and the one that said worship should be done in the mosque, even though they follow the health protocols. And the business world that is accustomed to face bargaining and transaction now are obliged to use online media. Business can still run despite its slow pace, but that is not enough, of course. Business people indeed feel the impact of the quarantine, which is enforced for travelers, either domestic or foreign. The enactment of the new normal in West Kalimantan began in Pontianak City on the 5th of June 2020. The rules and policy for the implementation of face-to-face schooling in West Kalimantan have been prepared. Simultaneous regional election for 6 agencies to be held on, not to be held, it's already done in the 9th of December have also been prepared at that time. After new normal, there are no debates from the community regarding implementation of health protocol, as long as they can continue with their daily activities. However, from our field finding, there are still protocol violations. That's why on the 24th of August, the governor launched regulation to regulate the application of discipline and enforcement of health protocol as an effort to prevent and control COVID-19. As can be seen from the graph, number of cases after new normal significantly increased. To overcome the current health crisis as well as the economic downturn, the government of West Kalimantan has made adjustment to to the 2020 provincial budget according to the condition given from Ministry of Finance concerning management transfer to regions and village fund for the 2020 fiscal years in the context of COVID-19. The adjustment of 2020 revenue target is a realistic one because due to the COVID-19, of course, people's income has decreased. Due to this, it is predicted that government revenue originating from regional tax revenue and regional levies will decrease, and also central to regional transfers will also decrease. So based on the said regulation, West Kalimantan has met, the governor of West Kalimantan has made adjustment in the in form of 35% reduction in capital expenditure and other good expenditure as well. It's allocating more spending on healthcare and other matters related to prevention or handling of COVID-19, and also social safety net and management of eventual economic fallout. So although the number of COVID-19 cases in West Kalimantan is relatively low compared to the several provinces in Java, the economic and social impact of COVID-19 are present and create problems to the community, business world, and the government. Tourism is the sector that has been significantly affected during the pandemic. In general, as of July 2020, the number of air transport passengers coming to West Kalimantan has decreased by 75%, and while those departing have decreased by 65%. The similar also with the sea transportation. The closure of Supadio International Airport, the closure of PLBN or border crossings, and the implementation of quarantine measures in Indonesia's major cities has had a significant impact on the flow of people and goods in the province. So as seen in the graph, the number of foreign tourists dropped by 79%. Many tourists to West Kalimantan came from Malaysia and Brunei Darussalam. So this is the data on economic growth and unemployment before and during the pandemic. The contraction in West Kalimantan economic growth is higher than in Indonesia. From the supply side, it was driven by negative growth in main sectors such as agriculture, manufacture, retail trade, and construction. While on the demand side, the government sector played an important role to cushion the shock in West Kalimantan economy. And then in terms of unemployment in West Kalimantan, as of August 2020, it was 5.81%, higher compared to last year at the 4.35%. Based on BPS report, as many as 300,000 of West Kalimantan manpower was impacted by COVID-19 pandemic, including 15,000 of them were temporarily laid off and 269,000 workers that have to work with shorter working hours and thus getting lower income. This is our concluding remark. The COVID-19 pandemic presents a big challenge for West Kalimantan. So as the third largest province in Indonesia, with an area of 147,000 square kilometers, or 1.13 times the area of Java Island, West Kalimantan is divided into 14 regencies and cities. The health and economic crisis has had differing impacts in its regencies and cities. So much so, uniform policy will have different levels of effectiveness. Moreover, as a border province that's a borderland with Sarawak, Malaysia, West Kalimantan is vulnerable to the negative impacts of COVID-19 control measures that influence trade and movement. The current handling of COVID-19 pandemic by West Kalimantan provincial government is in line with the guidelines set out by the national government of the Republic of Indonesia, which is investing on methods of detecting and preventing the spread of COVID-19, creating social safety nets, as well as multiple buffers to mitigate the economic's fallout of the pandemic. Despite such measures, the number of cases has risen exponentially, and the last 3 trimestral economic performance index has rated consistently lower than last year's figure. So a contributing factor to the developing situation is the general public's behavior toward the pandemic. Some attitudes observed in West Kalimantan were that of apathy and ignorance, where people still behave according to social norms and convention that have yet to be adapted to the current situation. Possible explanation for this trend is insufficient of socialization in the dangers of the pandemic and a weak enforcement of health protocols on multiple establishments. My last slide, I saw campaign from Malaysian side and from Indonesian side. We can see that we use a term that is actually not always familiar with many people in Indonesia, while in Malaysia they simply use Bahasa Melayu to tell people to stay apart from each other. I think that's it from me, Ibu Tri. Thank you very much.
Thank you very much, Ibu Nurul, for timely presentation. So before we move on to our third presenters, I would like to remind the audience to share the question using the Q&A box below in the Zoom platform. So then we can read your questions during the question and answer session. So we will move on to our third presenters, Pak Agus from Komnas HAM. About 15-20 minutes, Pak Agus. Floor is yours.
Okay, thank you for moderator IRSA, FKP, all participation on this seminar. In this seminar, we are Agus and Zsabrina will present a paper with the topic the challenge of regional election during the COVID-19 pandemic in Indonesia. And then next, yeah, in this presentation, we five chapter. At the first is introduction, secondly about the response of government and KPU, third about complaint issue and threat of spread of COVID-19, third, fourth about participation and effect of turnout, and five conclusion and recommendation. And then we choose this topic. We have four regions. At the first about Pilkada in 2020 is the big Pilkada, the big coverage. And then we look on the map, 9 province level, 2025 regencies level, and 37 cities level is very, very big. And then voter and official, we look based on final voter or DPT from KPU, 100.1 million voters, and then additional with involved of official with 3.3 million official to in a ballot station. I think it's very, very big and more than half of DPT from a president election. When we look on the map, we have a red zone, yellow zone, and green zone. We look at West Sumatra, Bukit Tinggi, South Sumatra, Banten, Java, and East Java is a very, very red zone in area. And only Sumeneb Regency is a green zone. And then we next step. Yeah, I think the situation is a second wave about pandemic. We look at the data from Satgas COVID-19. In March 15, only 21 a day suffered. At July 16, more than 1,000 a day. September very increase again, 3,000 again. November and now in February 10,000 a day. I think it's very, very increase COVID-19 and second wave about after election. We know some KPU like in Tangerang Selatan was dead about COVID-19. Next step. Next, the method is this paper. We using a qualitative descriptive method. We focus from expert like Sigit Pamungkas from KSP, Hashim Asyari from KPU, Abhan from Bawaslu, and the expert from Lambung Mangkurat University, Mr. Mirza, and then Muhammad Kodari from Indo Barometer, and Panduriono and Asko Badgani. He is an epidemiolog. And then we site visit in Depok, Jawa Barat, and Zsabrina to South Kalimantan to monitoring the how implementation the health protocol in election. And then Zsabrina. After we look the method, we look how to the response of government and KPU to the election during the pandemic. We look at the government make Perpu number 2/2002 have the legitimate to postpone until 2 months. And then Minister of Internal Affairs, Mr. Tito Karnavian, talked about the problem will the election will postpone. We must prepare 2070 temporary official. It's very difficult to prepare this ASN with the minimum and middle pratama level. And then Mr. Erlangga Hartanto statement. This 35 trillion, this is only to stimulus economic. Government always to make economic again after minus. And then President Joko Widodo instruction with the regional election must be done because the pandemic will end, we don't know, and then like this. After this situation, the government make the law with Perpu 2 and 2002 to make postpone the election. Next, yeah, the optimism of government to continue stage of regional election based on the experience of various landing countries like South Korea, Mongolia, Singapore, and then other countries. This is make confident from the government. And then we look the Institute of Democracy and Electoral Assistance EDIA report of 53 countries then continue stage after the pandemic. And the Sigit Pamungkas from the President Staff Officer and former KPU talked in a meeting in Komnas HAM and seminar. After the election regional will postpone, it will raise serious problem in Indonesia, delaying with legitimate human right, like right to participate in the government. Maybe Zsabrina will continue to this presentation.
Okay, thank you, Mr. Agus. So I will continue the presentation. Although Perpu number 2, year 2020 is the basis for postponing the elections, however, it doesn't regulate election procedures. Therefore, it is operationally entirely returned to law number 1, year 2015 as an instrument that regulates elections in normal times. The implication is that all the stages and mechanism of the elections are still the same as the previous elections, especially in the voting and vote counting stage, that still using manual and conventional methods without technology that reduce assembly activities except for the addition provisions for the use of mask and glove regulated in PKPU. KPU has established several operational regulations, including KPU regulation, or as we know, PKPU number 5, year 2020, and PKPU number 13, year 2020. However, this regulation is still very limited because it only manage 4 stages or activities during the elections, and it's just selected provisions during the elections, such as the representative or the health protocol and the sanctions. So we can see from the above explanation. So now we will talking about the compliance issues and threats of the spread of COVID-19. Despite the existence of PKPU, which became the guideline for the implementation of regional election during the COVID-19 pandemic, candidates, campaign teams, and candidate supporters had low commitment to obey the health protocols. Bawaslu reported from 25 September until 25 October 2020 that were found 918 cases of health protocol violations. And most violations occurred during the campaign period that still use face-to-face method in 256 districts or cities, whereas only 14 districts using the online method. Of these, 33 were subject to administrative penalties, 6 were sanctions with a code of ethics, 5 were submitted to the police for criminal reports, and 41 others were subjected to other penalties. In connection with that, Indobarometer criticized PKPU because it only regulates candidate registration and campaign stages. Therefore, as long as there are no reliable, comprehensive regulations and state institutions that control crowds, the regional elections will only increase COVID-19 victims. The indication of the threat is based on the assumptions from a total of 305,000 polling stations with a participation targeted of 77.5%, then multiplied by the voters in the final voters list or DPT of around 105 million, as many as 82 million people came to the TPS. And based on the data from the Satgas COVID-19, since the beginning March until November, leading to voting day on December 9 2020, there has no trend of decreasing of COVID-19 patients. And then we also relating to the statement from Panduryono and Askobat Ghani that the average percentage positive rate is 14.3 until 15%, then 15 out of 100 people are positive. Therefore, an estimate of around 15 million of the total 105 million voters in 2020 elections has the potential to become positive COVID-19 patients. For this reason, it is important to anticipate and prepare the infrastructure and funding allocation from the state budget or APBN, as well as the readiness of hospitals and medical personnel. And we can see from the graph above that the total cases on 25 September or at the campaign stages, there are 266,000 cases, and on the 5th December 2020, there were 569,000 cases, and after the elections, exactly on 20 December 2020, there were 664,000 cases. And then we also revert to the KPU data that until September 15, 2020, there were 63 regional head candidates who tested positive for COVID-19 from a total of 738 candidates. And also Bawaslu state that 1,172 cases of KPPS officials infected by COVID-19 but are still on duty, like in Tomohon Nur Soluasi, and as we went to the field trip in South Kalimantan. Now we will give you some findings in our site visit to South Kalimantan. There were some health protocol violation there, such as the KPPS officers and the bystanders did not wear face masks, and the distance between officers really close to each other. And then it is also known that the KPPS officers just smear ink onto voters' fingers, that it has become the potential of spread of the COVID-19. And also, we also found out that the turnout is decreased in South Kalimantan because more people did not come to the polling stations because they were afraid to the COVID-19 spread. And then about the participation and effect of turnout, one of the most crucial issues in election during the COVID-19 pandemic is related to voter participation. Public participation is the center for democracy because the main purpose of elections is to achieve a democratic order for a credible determination of government. Some countries that have conducted election with increasing voter turnout rates include South Korea, Singapore, and Mongolia. Even though there is voter fear of the spread of the COVID-19, proper mitigation and facilitation will increase the number in the participation voter. Meanwhile, for countries whose voter participation has decreased significantly, it turns out that the main indicator is that voters are more concerned with health and safety factors, so that they are willing to lose their political rights by not coming to polling station because they will be at risk of contracting COVID-19. French has led to low turnout or abstention climb almost 20 points since the 2014 to a record of 55.4% in 2020. And as we know that 2 days after the voters went to the polls, the country entered a lockdown. And then based on this consideration, Kevin Casas-Zamora conveyed 4 factors to give confidence to the public to be actively involved in elections even though in the COVID-19 pandemic, namely, first, government and election authorities in making decisions must be inclusive and transparent. Second, the ability to work across institutions and conditions. Third, the availability of infrastructure and various voter mechanisms in exercising their rights that have been well prepared from the start. And last, periodic and systemic review of the rules governing the administration of elections. Returning to Indonesian context, the KPU is optimistic that the voter turnout is targeted to reach 77.5%. That turns out nowadays from the data from KPU, our turnout is about 76%. Even so, in fact, Indonesia still has various shortcomings to ensure the level of voter participation during the COVID-19 pandemic, as the criteria from Landman and Zamora especially regards to: first, there is no credible and comprehensive legal infrastructure to guarantee the COVID-19 prevention during the election, especially in voting and counting stages. Second, there are no new changes that take advantage of technological developments such as electronic devices, hybrid models, and by mail for voters to voice their rights. Likewise, the calculation stage was still manual, even though our government is launching a Sirekap system, but it didn't reliable because it has several problems, like it caused error several times, and it will not good for the process. And then the third is the absence of special or mobile polling stations for vulnerable voters has resulted in the potential loss of voting rights. Even there is a policy from each polling station, it is possible that the time is only 1 hour, with ballot reserve only 2.5% of the total DPT as backup paper, and it is impossible for several officers to serve in vulnerable areas with one hazmat suit. And the last, there are 1.5 million voters who are 17 years old or married but do not have national electric identity or KTP, that they are threatened with being unable to exercise their constitutional right on 9 December 2020. So our conclusion and recommendation, consequently, the government should facilitate the elections while still prioritizing the right to health in the entire process. There are several possible alternative recommendations, such as the first is to carry out sectoral elections with the zoning for the spread of COVID-19. Even so, this choice has risk because require a political decision as a follow-up to Perpu number 2 year 2020, and to eliminate the meaning of simultaneously, which is the aim of simplification and efficiency in elections. Second is to continue to carry out the simultaneous of regional election stages by combining conventional mechanism and the use of information technology like online and hybrid system as follows. First is the distribution of hours at the time of direct voting by considering health protocols and using a hybrid mechanism in red and yellow area. Post and online is the most appropriate option to avoid crowds. Even so, the challenge are the need for regulatory support through amendments to Law Number 1, year 2015, and PKPU will regulate the voting and counting mechanism using information technology. And it is necessary to allocate budget, human research, and technology. And the third is to encourage more effective collaboration between the government through the Satgas COVID-19, KPU, and Bawaslu to supervise the compliance of all parties in every stage of the elections by applying health protocols, including measurable law enforcement, so that all parties are obeyed. Thus, it is hoped that the right to public health and the right to participate in government will remain guaranteed because the regional elections are not a means of spreading of COVID-19. Okay, that's all for us. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you Pak Agus dan Mbak Zsabrina for a very nice presentations. So now we have complete our presentation sessions. I will read some important points that I've gathered from three presenters. The first is regarding presentation from Pak Rimawan. He emphasized on the social capitals during the COVID-19 pandemic that involved in Jogja. They use the local wisdom, SONJO, and then they also share some accomplishment from the initiative. And the second is from Ibu Nurul. She describes the situations in West Kalimantan where we share borders with Malaysia, and during the new normal, Ibu Nurul mentions that the cases significantly increase, and the government responses also takes a quite significant expenditure, so the deficit also increase. And Bu Nurul also mentioned the contractions of COVID-19 pandemic is higher compared to Indonesians in terms of the impact. The economic impact is higher, even though the casualties and also the infection rate is lower. So I think this is very interesting to further discuss. Our third presenters, Pak Agus, he and his teams explain about the situations, the dilemma that we face regarding the elections during the pandemic. They also mentions the risk of the increase of infections. They also concerns about the voters' participations that might decrease because people keen more into the health considerations rather than fulfilling their right to vote. So I think that's a very nice presentation from our three presenters. We have received some questions. I will read one by one, and I will request the presenters to respond. So first question is from Pak Max from LIPI. So Pak Max, the question is directed to Pak Rimawan and his team. Yeah. So Pak Rimawan has something else to do. So then his team, Mas Arya, will help him to respond the question. So Pak Max asking about the culture dimensions. So he asks that SONJO is very inspiring, and in your presentation you start with social capital trust, and cultural dimensions is embedded in the business model. So the question is, do you see any academic implications of SONJO for further study? That's the first question. And the second, in terms of policy implication, what kind of support you think need to be advanced for more solid and balanced partnership between government and civil society? So I think I will give this opportunity for Mas Arya to respond this first question.
Thank you, Miss Mulyaningsih for the question, and Mr. Maxensius Sambodo for the first question. Let me introduce myself. My name is Putu Wigita. I'm the second author of the paper representing Pak Rimawan right now because he is not able to continue our discussion. Okay, for first question, do you see any academic implication of SONJO for further study? Of course we do, because there is for research before, social capital always been an interesting topic to do research with. As we know, there is a research about the social capital at earthquake disaster at Yogyakarta, and also for the same disaster at Gili Trawangan. And of course, will be an interesting topics for the research. For the second, in terms of policy implications, what kind of supports you think need to be advanced for more solid and balanced partnership between government and civil society? If we talk about social capital, in my personal opinion, we not involve central government, or because if we involve the central government, then it will be changed into a formal situation or formal strategies, and therefore there are many constraints ahead. And if we focus on the people, maybe we can expand our link on our networks to outside Yogyakarta. For example, there's the same movement or similar movement on Depok and also in Magelang, and this will be interesting for research also. And maybe, in our opinion, this is the further support from the people, not from the government. In my personal opinion, of course.
Okay. Thank you, Mas Arya, for your clarification. So he mentions about the influence of social capital, right? In terms of helping and giving economic and also social impact during the pandemic. So our second question, still from Pak Max. So I will show the questions. So this question is directed to Ibu Nurul. Ibu Nurul, thank you for sharing the study. Pak Max is wondering why in Sintang that the number of infection is higher than other border. Can you give more insight in terms of workers' mobility? He also asks, did Malaysia have similar treatment of border security? And the third one, in approaching Imlek and the 12th of February, do you see this may lead to increasing new number of COVID cases? And how can we prepare to mitigate it? Silakan Bu Nurul.
Okay, thank you, Ibu Tri. So thank you, Pak Max, for the question. So regarding Sintang, Sintang is one among 5 borders in West Kalimantan. Malaysia imposed a similar policy to all the borders. So they closed all the border because they locked down the country. So nobody can cross officially to Malaysia right now, unless they have a reason such as to get treatment in hospital. It is allowed by the Malaysian government. However, Sintang, even though there is no crossing during the pandemic, Sintang also share border with other regencies, another 5 regencies in West Kalimantan itself. And there is no restriction of mobility inside West Kalimantan and also to another province, which is also bordering with Sintang, the Central Kalimantan. So Sintang also have a border with Central Kalimantan. So I think that's also contribute to the number of cases, even though there is no crossing from the worker, because there is no formal crossing in Sintang. The formal crossing is only available in Sanggau, Kapuas Hulu, and I forgot what Sanggau, Sambas, and Kapuas Hulu. So Sintang not yet have the formal border crossing, but because there is no restriction of mobility inside West Kalimantan, you can easily go to another regencies or city. I think that's also contribute to the number of cases. And then regarding the Imlek, and also the one that is more important is Cap Gome. So the government of West Kalimantan already imposed the regulation that try to prevent the increase of the COVID-19 case by implementing the obligation to provide PCR tests to come to Pontianak. So if you travel to Pontianak, it is not enough to have a rapid test, antigen rapid test. It is not enough. You have to do the PCR test. And if it is proven negative, then you can come to Pontianak. And it will be imposed until the end of February, because end of February will be the Cap Gome celebration. So I think that's the one that is, the government do not ban people to come to Pontianak, but they provide a stricter regulation. I think that's my answer, Ibu Tri. Thank you.
Thank you, Ibu Nurul, for your response. So the next questions I will also share in live. It's again direct to paper by Pak Rimawan and Mas Arya. This is from Pak Sujarwoto. So he say that we saw the number of COVID-19 infection in Jogja has increased significantly. Why the reason behind this substantial increase of infection? Do you think social capital may also contribute to this increase? And what is the contribution of SONJO to the pandemic preventions in Jogja? Monggo Mas Arya.
Thank you, Mr. Sujarwoto, for the question. In my opinion, do you think social capital may also contribute for the increase of the infection? Yes, because as we know, the social relation, the crowd is also can hinder the people or the government from preventing to social distancing and many other strategies. And in my opinion, it is happened in all across areas in Indonesia. So maybe one thing that contribute to them is social capital. And up to this point, what is the contribution of SONJO to pandemic prevention in Jogja? Up to this point, maybe we are greatly socialized for the people who have the disease COVID but has recovered to contribute on their health or blood conservation plasma, because as we know, this is the best strategies to tackle COVID pandemic right now. And we also have a program in terms of mediation between the hospital and also the people who are suffering from pandemic to Jakarta. So we can match whose hospital has the best or has more room to support with, and which hospital has not. Maybe it is my answer.
Okay, thank you. I think your study attracted many questions. So it's a good indications that this very interesting study. So there is one more question, Mas Arya. This is from Asi Halomoan. Yeah. I think he or she previously asked about the cost. Pak Rimawan mentions the cost is zero, but if we look into the number of times that you devote for the program, so it's actually not costless. So the audience suggests it will be good to see the formal analysis of the cost. Indeed, it can be small, but it can be very large. If this has been measured, perhaps it can be included in the paper. Perhaps the comparisons of how SONJO is more cost efficient and effective compared to formal institution is useful and can strengthen the policy recommendation sections of the paper. So basically, this is a suggestion for your paper. So maybe you would like to respond, Mas Arya?
Okay, thank you, Mr. Or Mrs. Hasi Halomoan. I'm very agree with you, and if we connecting our dots with the previous question about how the SONJO can be interesting for the academic policy, maybe this is the one, because we have not been measured or the cost of establishing SONJO, and maybe for the other social capital as well. So yes, I think this is a great recommendation for our paper to improve or more cost efficient and effective compared. Yes, maybe this is a good policy recommendation for our paper. Thank you very much, Mr.
Okay, so thank you very much. I think all questions in the chat box has been answered. This is 127. I think we have done with the questions answer sessions due to the time limitations. And thank you all for your participation. It's very nice to have good and rich discussions. And before we end the seminars, we still have one more information. So our colleague from Universitas Gadjah Mada, Mas Gumilang, he's going to share our next conference. So it's very exciting. So 2021 conference in Yogyakarta in UGM. So Mas Gumilang will inform to give you more information about the conference, and hopefully we will be able to see you on July. Mas Gumilang?
Thank you, Putri.
Okay.
Indeed, it's very exciting. Please allow me to share a very brief presentation regarding the 16th IRSA conference in Yogyakarta next July 2021. Yes, as you all know, the IRSA conference is IRSA's main annual event that promotes the advancement of research across the country. The conference will facilitate open discussions, debates, transfer of knowledge, strategies for policy formulation, and networking among scholars and policymakers. So each year, since its establishment, the IRSA annual conference has been attended by many academics and policymakers from numerous Indonesian institutions. So the 16th Indonesian Regional Science Association International Conference is going to be hosted by the Faculty of Economics and Business at Universitas Gadjah Mada in collaboration with IRSA. So the main theme of the 16th IRSA conference is institutions, human capital, and development. The conference will be held between July 12th and 13th, 2021 via Zoom webinar. The official website can be accessed through this following link. We will share the presentation slide after the meeting. So there are three broad topics. The first one is institutions, and then human capital in general, which is education and health. So there are many topics that a lot of scholars as well as policymakers can contribute to. So we look forward to receiving your abstracts for a review to the conference. We will also invite keynote speakers as well as plenary session speakers. So we aim to invite Professor Lam Pritchard, who is the Rice Research Director. We also aim to invite Professor Remahana from Harvard Kennedy School, Professor Arief from Universitas Indonesia, Dr. Asep Suryahadi, who is also in this discussion, I believe, from Semeru Research Institute, as well as Dr. Ariana Utomo from University of Melbourne. We will also have a book launching written by Professor Iwan Jaya Aziz of Cornell University, and we will have discussions for the book launching as well. Another tradition of IRSA International Conference is the pre-conference workshop. So we're very excited to announce two pre-conference workshops. The first one is the introduction of Geographic Information System by ANU Indonesia Project in collaboration with University of Canberra. This is going to be delivered by Dr. Yogi Vidyatama. And then we will also have Introduction to Choice Modeling for Economic Valuation by EEI Indonesia, an institution led by Professor Arief Ansori Yusuf. And we're also still in discussion with Jepal Say to conduct a pre-conference workshop on Introduction to Online Survey Design. So as informed in the IRSA conference, this is going to be the registration fee for participants, presenter, and then student presenter based on the time of registration. And then you can also access the registration through the Comftul website that we've provided for the 16th IRSA conference. These are the important dates for the conference. I guess, we shared the flyer regarding abstract submission opening, which was on January 6, 2021, and we will open the online submission until April 4th, 2021. So we have still about 2 more months until the end of the abstract submission, and then we will go through the process until the conference date in July 12th. Thank you so much for the opportunity to share the exciting IRSA conference. We look forward to receiving your abstracts, and we look forward to having you in Jogja via the Zoom webinar. Thank you, Putri.
Thank you very much, Mas Gumilang, for the information. So hopefully after this, then we will receive more abstracts submit to the conference. Considering the speakers and also the plenary sessions and also the parallel session must be very exciting. So Alhamdulillah, we able to manage the seminars in 1.5 hours. So we have listened to 3 presenters. We also have listened to information from 2021 IRSA's conference chair, Mas Gumilang. So I would like to conclude these seminars, and we will look forward to see you for next week's IRSA seminars. And I'll return to Mbak Lydia. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Makasih Mbak Tri.
Makasih Tri.
Welcome.
Halo Lid. Oh, itu dia Lydia.
Terima kasih Putri, terima kasih semuanya. Thank you all for speaking. That was a really great session with IRSA. I'm just sharing, like, next week we will have another webinar, the second part of the IRSA collaboration. You can see on your screen the schedule and the speakers. So that's it from me. Thank you all participants. Thank you everyone who has attended the event, and I hope to see you next time. Bye everyone.
Bye, Lid.
Okay.
Thank you, Arief.
Thank you.
Yeah, I'm also sharing the grant, I think, that will be provided by IRSA if people would like to submit for grant application. You can check the website for more details.
Terima kasih Mbak Lydia. See you next week.
Sama-sama. Terima kasih banyak Putri.
Terima kasih Mbak Lydia,
Selamat makan siang semua.
Bu Nurul.